pledge will be led by the gentlewoman from Texas, Ms. Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Eddie Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Eddie Bernice Johnson.
Hello, and welcome to another episode of Capitol Report. Today I have three guests, all of whom work at the community health centers in Dallas and who are traveling in Washington this week. Joyce Tapley, the CEO of Martin Luther King Jr. Family Clinic, joins me today, as well as two women from a well-known community health center, Los Barrios Unidos Community Clinic in West Dallas. And I might add that both of these clinics are in my district. And she is Director of Development, which is a very important job these days, raising money, that means. And the marketing is Jolene Bagwell. And so today we're going to discuss the value and the use of our community health clinics. We think that it's great work, and these women do tremendous work and have tremendous responsibility. I know because I have visited these clinics, and there are young people, even very small young people there with parents to get primary care. And I think it's a wonderful way to do it because they're out in the community where they don't have to travel all the way across town to another larger facility. So we're delighted to have these facilities. And I want to know now, what brings you here? Is this like going to the bank to hold it up? That's where the money is or something? Are you having a conference?
We are actually here for the National Association of Community Health Centers annual conference, Policy and Issues Conference, and we're also here to visit our elected officials. We're very happy to be here from Dallas, Texas.
Well, thank you. This is a very interesting time because we're dealing with the budget with not many figures on it, but a lot of principles. And I hope they'll give us some figures before they ask us to vote, but we never know. But community health centers are really highlighted in this budget because we're trying very hard to make health care available and accessible to all the people. And this is one way that it can be. And we have a number of community health centers and might be getting more because of the population growth and where it is and where they can get to it. And how do they differ from a private clinic?
Community health centers principally are different from other healthcare practices because they are community governed. What that means is our patients serve on our board of directors. They dictate the type of care that we will offer. That makes us very different from even other nonprofits. We practice evidence-based medicine, and we have employees that commit to work for us for many, many years, decades in some cases, to provide quality care to our patients.
And another thing that community health centers do that's different from private practice is that we try to operate and provide services focusing primarily on uninsured patients. We take Medicare and Medicaid, but we also try to design ourselves and set ourselves up to be a one-stop shop so that a person can come in and they can receive services medically and for dental services all in one location.
Mm-hmm. I have seen whole families come.
Yes. Mm-hmm.
And so it makes it easier for working parents to come in, get it done, and leave together.
Yes, our youngest patient is 1 week old, and our oldest patient is 107. So we see
that's quite a spread.
It is definitely, and they come back because they know that they get good quality care, and again they can see the medical person and the dental person all in one place, and also receive pharmacy services. So we do everything.
And most of these people do not have insurance.
Most of them do not have insurance, and because we receive partial funds from the federal government, that allows us to discount our services based on their income and family size. And so it makes it a lot more convenient for them. Again, they get good quality care, they get good professional care, and they also hopefully leave getting well, because we have been able to diagnose people with cancers, with different types of sexually transmitted diseases. We've been able to actually in our center, we've identified young kids very early on with some type of congenital disease, and we've been able to treat them or refer them out to a specialist and follow up with them. So they get a lot of services, and they leave happy, and they tell others, and they come back. And that's one of the main
Congresswoman
things.
Johnson, you remarked, having been to our building at Los Barrios Unidos Community Clinic, that we are in one of Dallas's most impoverished areas in West Dallas, and our clinic is big, and it's beautiful, and it's clean. 80% of our patients are uninsured, and we provide care, and the care we provide is excellent and top-notch. So community health centers have learned how to provide care to anybody, regardless of their ability to pay, without stinting whatsoever on the quality of service, but doing it in one of the most effective ways possible. So I'm really proud to be working for a community health center. I'm proud that you support the concept of community health centers as well, and want to take this opportunity also to thank you for the support of the ability through some funding, the stimulus funds, to be able to open a new community health center in Grand Prairie, Texas, because of your support. We receive funds, and it says, U.S. Congresswoman Eddie Bernice Johnson, in appreciation of your outstanding commitment and ongoing support of community health centers for Los Barrios
thank you very
Unidos
much.
Community Clinic. So thank you so much for your support. And
All these young faces on here, I could hug every one of them.
yes, we would love you to come hug every one of them. So it is a way to provide care for those who otherwise would not be able to afford care, but as I said before, not stint at all in the quality of care, and do so in an affordable manner.
Well, you know, Texas has the largest number of working people that do not have insurance.
Yes.
And so people that don't have insurance really would appreciate having this access to health care. And if they had access, they wouldn't be able to afford it
Exactly.
right.
Right. We
because of what they're making.
We keep our costs low with how we deliver the care. We also, in the state of Texas, have over 50 community health centers, federally qualified health centers, and so we are expanding as much as we can. It is definitely helpful to have the stimulus money as well as any other kind of support we can have from the president. And we want to be around for a long time. I've been at Martin Luther King Family Clinic for 10 years, and I've seen growth in a lot of areas, but I've also seen a lot of growth in the uninsured. And so we expand our hours and have late hours. We try to stay open on weekends. We do whatever we can so that we can make it convenient for our community so that they're not having to go to the emergency room unnecessarily.
Well, that's great. When I visited, and we've had our First Ladies visit the Martin Luther King Center, but when I was there with one of them, the younger people were teaching older I think they were from Germany, Jewish women and men, English, and they were learning from them, and they were like the grandparent figure, which I thought was a great program.
Yes, yeah, we try to do anything that we can to communicate with other folks from other countries. If we have quite a few Spanish-speaking employees, so we try to do whatever we can to employ the right types of staff members so that they can communicate and relate to the patients that we serve. We try to reflect the patients we serve. And we see folks who are from the immediate community, South Dallas community, plus folks from other countries. So we try to
What
make
is
those
your
services.
diversity there?
We have primarily 60% or 69, actually 69 because it's grown, 69% of our patients are insured, 60% are black, and 35% are Hispanic. And we have about that much of a ratio with our staff members as well.
Now, you have probably somewhat of the opposite. You have
Very similar, very high uninsured. We've got 80% uninsured, and probably just above 90% Latino, and a number of probably about 8% African American.
And we've been doing some outreach because we realize now with the economy as it is that there's a new uninsured, and it may be people who know nothing about community health centers, or that our doors are open regardless of ability to pay, regardless of race, regardless of any of that. And so what we're doing is some special outreach, and any time we can appear on programs like this one, like yours, or anywhere to say, please, you know, whether it's Los Barrios Unidos Community Clinic or whether it's the Martin Luther King Family Clinic, no matter what, if you are uninsured right now and you are struggling, please bring your children, please bring yourselves, and don't stint on your health care.
That is extremely valuable, because many times when people become unemployed and lose any benefits that they have, they're hesitant to go for care because they can't afford it. And so to know that this is available, it helps the general public because it keeps communicable diseases controlled.
That's right. We keep kids in school. We keep kids healthy. We keep dads at work. We keep moms at work. We do everything we can to shorten the visit. In other words, they're not there for all day. They're not there 8 hours or 10 hours or 12 hours like they would be in an emergency room. So we do everything we can to shorten the visit, have lots of time with the doctor, but do what we can to shorten the wait. So that we can get kids back to school, so that we can get moms and dads back to work or back home.
And are you tri-levelly funded? You get federal, and you get what?
Federal, state, and local.
And local.
And we received...
And then you raise money,
right,
don't you?
yes.
Yes.
We just recently received a little over $500,000 from Crystal Charity Ball. So now we're going to be able to provide specialty pediatric dental services within our facility. It'll allow us to hire an additional dentist and a dental hygienist and some other staff, and we received other funds for renovation.
Dental service is extremely important for our young people, because they can get dental caries and have heart conditions, all kind of other illnesses.
And we know people have died, children and adults have died from infections in the mouth. The body is all related, but everyone doesn't understand just how important it is that they get that prevention, and if there is some kind of pain, that they have it addressed immediately instead of waiting until they really can't function very well, or the kid constantly misses school before they actually come in to be seen. So we really try to do whatever we can, go to schools, and we talk to parents and get the word out to let them know that we're available. Our hours are available, are much more efficient, and our hours are designed in a way to respond to what patients say that they want. We do patient satisfaction surveys to find out what their needs are. When do they want us to be open? Where do they want us to be? So we try to respond in any way we can.
Well, that's tremendous.
We've also,
and I see you shaking your head, so you agree with all of that.
Absolutely.
We've written a grant to expand our mental health care as well. We want to integrate mental health care with primary care, because we understand that often when somebody may be struggling with postpartum depression or depression from diabetes, that it would be the primary care doctor that might be the first place to recognize.
Yes. Right.
So we want to integrate mental health care with primary care. And that's another thing. I don't think that community health, most people, if they even know community health centers exist right there in Dallas, for anybody who's facing economic difficulties, they don't understand just how many different services we provide, which is convenient for a parent to know that mom, dad, the children can go to one place. It isn't as if you have to take off work and you run to one doctor in one place and one doctor in another place and a pediatrician in another place. It's all under one roof. So.
Oh, that's great.
Yeah.
And I know that you're bilingual, which really.
That's absolutely.
Yes.
Absolutely. We're very proud to say that we speak English and Spanish. We also can make arrangements for if someone speaks yet another language or American Sign, we make arrangements for that. So really, truly, everyone is welcome at our clinics. We really feel like we're in the business of access. We are improving access, and we don't want something like not knowing their language to be a barrier. So we really strive to understand our communities and be sensitive to the needs of our community.
About how many people do you serve a year? Or
we see, in 2008, we saw 21,000 patients at our West Dallas clinic.
We had 20,000 visits from patients. We have about 7,500 individual users, but they come often throughout the year. So we had a little over 20,000 visits.
That's a lot of visits.
It is, and you know something, we realize that we know it's not enough, because there are patients who have chronic diseases and they don't come as often as they need to, because it could be they don't have enough money or they don't have the transportation. So we try to accommodate them by paying for their taxi if they need to come and come in.
That's right.
And we try to do things at discount or even set up services where they can get their medications for free. Our goal is to be able to get a lot more patients healthy and keep them from getting sick.
Yes, the mental health component is very important. The majority of the people that are homeless really need
mental health issues.
care. And you know, they'll go to an emergency room when they're sick, but as soon as they leave that emergency room, they don't have access to keep the wound clean or
That's right.
whatever else they have to do. Plus, you know, to be homeless is really a very emotional situation, take a really emotional toll on people. So adding that component would probably be very, very important.
Fortunately, where we are, we're in the King Center, and the building right next door has Dallas Metro Care. So they're just that close where they can either come over and take care of the patient while they're in our center, or we can send them. We walk them over to make sure they get there and get the help so that they can go ahead and get seen and then come back to us for follow-up.
I know
That's
the
helped us.
beginning of our homeless population in Dallas came right after the lawsuit where the patient had a right to treatment, and
That's right.
they discharged
Right.
a lot of people from the state mental
That's
right. Yes,
institutions.
That's right.
And they left with medications, but they didn't
No
keep them
follow-up.
up, didn't know where to
That's
go.
Right.
That's right.
And so they ended up with behavior that was not normal because they couldn't
That's
get the
right.
medicines, didn't know how to really take care of themselves. And
Right.
Yeah.
some of them actually had some family, but because of the behavior, they couldn't.
They don't know how
They
to
weren't
manage to
Yeah,
stay.
it wasn't easy
That's
to stay
right.
at home. We also, Los Barrios Unidos also has a partnership with Metro Care Services, Dallas County's mental health provider, in both of our clinics, including the new Grand Prairie Clinic that you helped us open and get started. And so it's a really exciting partnership for us too.
Yeah.
And that's another thing, that most community health centers, we're not nonprofit bubble in a bubble that operates alone. We learn how to partner with other organizations to deliver care and services. So we partner with mental health.
And we've learned that a good third of our patients that come through our doors for sore throats or diabetes or backaches or different things also have mental health issues. And it could be disabling depression or very troubling anxiety. And we have learned that they're not necessarily even going to talk to the doctor about that. That's a real skill to bring that out. They're going to talk about the pain, the physical pain that they're experiencing. They may not talk about the psychic pain, but we have learned to get some of that information out of the patient. And if we can train our primary care workers, and by that I mean our pediatricians, our family medicine, our internal medicine physicians, to look for those signs and symptoms, we know that compliance for their physical diseases and disorders will get much better. And on the flip side, I've talked to my colleagues on the mental health side, and many of their patients who come in for schizophrenia or for treatment for schizophrenia, for bipolar disorder, depression, have very troubling health symptoms. And sometimes it's their own symptoms that is a barrier to care. And so we really think it's a match made in heaven, partnering with an organization such as Metro Care, so that we are the physical health experts, and we can provide treatment to their patients, and they can help provide treatment to mental health treatment to our patients. So that it really is a new day of cooperation, even among nonprofits. So we're very pleased with the partners that we have in Dallas.
That is very important, because someone can have symptoms of an illness, a physical illness, leave, but if their emotional illness is not addressed, then it won't hold for long.
That's right.
Because the mental illness has a great
That's
deal
right.
of influence over the physical illness.
That's right.
And so when go ahead.
Particularly if the person who's suffering is the parent and the
Yes.
caregiver who's taking care of the kids, and or even having to be at work and take care of the kids. So we really feel that it's really important to address all of those needs. And when you can do that all in one stop, guess what? The patient will get better, and the patient will go back to work, and the kids will be in school.
Depression is a very common thing with impoverished people.
Yes.
They sometimes don't recognize it themselves.
That's right.
But don't know
now-
where to go
Yeah.
to get
That's
the
right.
help. And we one of the key things that we have to do as CEOs for the centers is that we have to hire the most appropriate staff that we think it can help address it.
That's right.
So we have clinical social workers on site too, who really there's a chance, a bigger chance that a person will sit down and talk to that person and share with them the problems that they're having that they may not share with their doctor until they feel comfortable. And then once they do, then that social worker can partner with the doctor and try to help meet those needs. And our social workers will go out to the homes too. And that's something that is real welcome from our patients as well, just because if they feel comfortable enough to talk to you in your setting, and then they feel welcome enough or comfortable enough to have them come to your home, then we know we're reaching them in a better way.
Well, that's great. Tell me a little bit about the Grand Prairie Center.
Well, the Grand Prairie Center, we actually applied for a grant and we didn't get it. And Lenore and the board of directors of Los Barrios Unidos Community Clinic knew that Grand Prairie was very underserved. It was a medically underserved area. And in a leap of faith, they opened the center anyway on October 20th of this year. Much less staffed than they would have done otherwise had the funding been available, but they did open it. And the goal, if it was fully staffed, was to see approximately 5,000 patients in its first full years of operation, with almost 13,000 visits. And that's of a largely uninsured population who otherwise would not have access to health care services. Now that we have received some funding to be able to fully staff, we'll be able to meet those goals of 5,000 patients in 1 year. We are having a grand opening, in fact, celebrating it because it is now a grand opening on April 17th. And we already have approximately 700 patients and families opening now. It's a very diverse population. And we couldn't be happier. The community is just embracing us.
Where is it located?
It's located on Small Hill Drive and Small Hill Road and Stadium Drive, which is actually across from the Grand Prairie North High School. So it's in northern Grand Prairie, right off of Interstate 30 in Dallas, Texas, and Beltline Drive and Interstate 30 in Dallas, Texas.
I know exactly where that is.
Yeah.
I used to have Grand Prairie in my district.
You did?
Really? Okay. So you know Grand Prairie.
You know
Yes.
Grand Prairie.
As a matter of fact, I had Grand Prairie also when I was in the state senate.
Oh, okay.
I've had almost every part of Dallas County except Highland Park and University Park.
No kidding.
And I stopped right at the city limits of Highland Park now. But I have a great constituency. It's very diverse,
Yes.
from the very wealthy to the very poor. And I don't know that there's any part of it that's hostile. And we have
this
people
is
from
one of
all
your
over the world.
constituents in the middle.
Yeah.
Certainly neither wealthy,
Yeah.
not very poor.
Well, we
So-
are definitely finding that, given the way the economy is right now, we are seeing a lot more people who had a lot of money, and now they don't.
That's right.
And so they're having to address a lot of issues. And so I know that they're definitely supporters of yours, but they're also folks that we can definitely welcome, because if they need the care, regardless of how much money they have or don't have, we're going to see them.
And you know, Dallas only has 2 community clinics, community health centers. Other cities like Houston have many, many more. So we're hoping, all of
Yes,
us
we
here,
are.
that we'll be able to expand and have more
Additional funding.
clinics serving the Dallas area, and just expand in Texas
Yes.
in general.
That's right.
Well, it really takes the load off of our public hospital facilities.
Yes.
And it takes a lot of stress off of people, because often they wait very long hours when they
That's
go.
right.
And it's not intentional, it's not done for
No.
punishment or anything.
Right.
It's just so many people to be seen. But we have the medical school there that helps a great deal as
Yes,
well.
absolutely. Well, we really feel like as community health centers, we can take a lot of that load off the emergency room. We really
Yes.
we don't fancy ourselves emergency rooms. We're not trauma centers. We never will
Right.
be. We don't want to be. But there are
Well,
a lot of
60%
people.
of the people that go to emergency rooms
Don't
are
need to
not
be there.
emergency room
That's
people.
right.
That's right.
And
Don't
so
need to be there.
we are there for them, and we have done a lot of things like expand our hours. We've got 2 evening clinics now. We've got weekend clinic. All of those things that entice people to emergency rooms, because their doctor is not available 24/7. But the more we expand our hours and make ourselves available, the better it is for the family and ultimately the community.
And you really have an increase because of the recession.
Yes.
That's absolutely the
That is
case.
right.
We are seeing a new picture of the new uninsured, and we've had some of the same patients for really decades now. We've been around for 37 years, but we have new people. When there was a plant closing not too far from us, and guess what? Just within a matter of weeks, really, as the insurance coverage ran out, we're seeing them in our clinic.
We had a story done on WFAA Channel 8 recently and received a call not shortly thereafter because they wanted to spread the good word of community health centers and that we were there, from a Richardson School nurse who said that the city of Richardson was struggling in terms of access to care for the uninsured and the underinsured. And we will be meeting with all of the Richardson School nurses very shortly to talk about the clinic, so that the Richardson School nurses, which is far north of us, as you know, will be able to refer their children to us, their young uninsured and underinsured patients.
Well, that's
potential
great, because I can tell you, we have such a high-tech environment,
That's right.
and those layoffs are coming.
That's right.
For each layoff, 2 other jobs usually go with them. The persons who help in the home, the person who help in the yard.
That's right.
If they don't have a job, they can't afford to keep the help. So then we have 3 for every job that's lost.
Yes.
And I think we lost like 46,000 this year in Texas. So we do have a job to do, and your job will probably get a little harder before it lightens up.
Well, we're people. It takes special people to work in community health centers. You have to have a desire to help anybody, regardless of where they came from. You have to have a desire to understand how important healthcare is. I always value, if we can value our car and keep it clean and keep it oiled and put gas in it, we need to value our lives, because we can't drive the car if we don't have our lives to take care of. It's our goal to be able to go out and educate people, let them know that they can come, they have a place to come, we can be the safety net provider, their medical home. They can always come and get any kind of care that they need, and even if they don't need the care, just come for prevention. So that they can make sure that they are not sick, or they don't have any type of illnesses and things. And
That
do
is
things
the
right
most
way.
important of health care.
Getting the shots
prevention.
for your
That's
children
right.
on time, getting your TBs every year, just different things that they can do to prevent themselves from getting sick. So that's our goal too, is to be able to really show that we care and have the folks learn to care about themselves and their health and their
And
families.
you teach.
Exactly.
Well, our time is about out, but let me thank you for what you do. You're much appreciated.
Thank you.
And I can tell you that there are many, many people in the area that's very appreciative of you being there, for your attitudes, for your receiving them warmly, and for teaching. So we thank you.
Thank you too.
And we thank you
Thank
for
you.
your support as well.
Thank you.
you.
And thank you for watching. We will see you next week.
This has been another edition of Report from Washington, featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.